Good afternoon, everyone, and welcome to this national webinar and launch of the Leading Change Toolkit. We are delighted to have you here with us today. So we'd like to start today with by acknowledging that the office of RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the Mississaugas of the Credit, which is Treaty 13. And this territory was subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peacefully share and care for the resources around the Great Lakes. This land is still home to many First Nations, Inuit, and Métis people from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By making a land acknowledgement, we are taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back to over 10,000 years. We encourage you to learn about the land that you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our part. So now I'd like to provide you with a bit of an overview of today, and you'll see the agenda in just a moment. We can just have the agenda, please. And really the purpose of today is to introduce the Leading Change Toolkit to all of you. We'll start in just a moment with thanking all of those people and groups that participated in the development of this resource. We are going to be introducing the toolkit, giving you a bit of a tour, explaining the social movement action framework, the knowledge to action framework, and some knowledge to action tools that can be used to support the use of this framework. We'll be giving you opportunities to ask questions, and we'll pause a couple of times during today to hear what you have to say, if you can use the chat box for that. And we'll also give you a bit of a tour of the live website that's live today. We'll talk about some next steps to support change agents, both at Healthcare Excellence Canada, our partners, and RNAO. And we'll end with a poll, show you our Leading Change Toolkit video. We'll have a photo and some closing remarks. And I just want to make sure that you're aware that this recording is in progress, and photographs will be taken throughout today and used on social media. And once again, please use the chat box that you can find at the bottom of your screen for any questions and comments. And it's my great pleasure to pass things over to Dr. Doris Grinspun, who is RNAO's Chief Executive Officer. She has been the co-chair of this Leading Change Toolkit and is also the founder of the Best Practice Guidelines program at RNAO and the BPSO social movement. So on to you, Doris.
Thank you so much, Susan, and thank you for acknowledging the land we're in. I am also located in Treaty 13, and it is a time of learning and a time of reflection and a time of action for all of us here in Canada. I don't know if our colleagues internationally know how much it has happened recently in Canada in relationship to the discovery of unmarked graves that has brought a lot of pain to everybody, especially to Indigenous people that have been saying this for decades without having been always heard. And recently also a court ruling for providing children of Indigenous families, Indigenous children, with their fair share of services. So the problems that we have had, that Canada has had, and the debt that we have towards Indigenous communities is not a matter of the past only, it's a matter of right now at the present here in Canada. And I think it's important, given the international nature of our event today, that people know that we are indebted to indigenous people for their land. Today is a day of celebration. It feels that way. It smells that way, and it is that way. And we are so thrilled that so many people from the international community are joining us, because you will be using this Leading Change Toolkit, and hopefully together we will be revolutionizing the world. But before we get into the toolkit, and as part of what we do with social movement, we want to briefly introduce you to the hashtag of today, so that you can tweet, you can use other type of social media, and the hashtag is Leading Change Toolkit. El hashtag para hoy día es Leading Change Toolkit, and of course, whoever that tweets most, and we will let you know after the fact, will get a copy of the book. El que hace más tweets va a recibir una copia del libro en English o en español. Así que tweet, tweet, tweet. You will learn later on that this is part of social movement and part of creating what we call collective identity. And we will learn a lot more when we speak about these terms in a bit. Please tag along RNAO also as you tweet with Leading Change Toolkit. Before we move ahead to the details of the toolkit, I want to, number one, recognize tremendously the national and international expert panel. It's a panel of experts. I do hope that most of them were able to attend today. It allowed us to meet brilliant minds, some of which we knew before, and some of which are completely a discovery through the work that we did together for almost 2 years. And it's a panel of about 60% nurses and the other 40% from other disciplines, including persons representing the public. It has brought richness, it has brought great discussions, and it has brought this final toolkit to you. And to just bring a bit of remarks, we want to have the video that Dr. Daphne and George put forward so you can listen to it. The voice over it, I don't see it now. It was working before. It's not working now though. PG, can you give us a hand with that? Because I cannot hear. I don't know if the rest can.
Just one moment.
Apologies for that.
In the meantime, I just wanted to let people know that there are some nice land acknowledgements in the chat box here, that people are recognizing the land that they are working and living on. So thank you very much for that. That's a great practice to be doing. I also see that Raul has put very clearly the hashtag Leading Change Toolkit that we're encouraging you all to use throughout today and beyond, as we promote the kinds of work that you're going to be involved in when you're using the Leading Change Toolkit. So that is a hashtag that is going to be used beyond today, and you can use it to share who's on your team, who's on your change team, what changes are you making, how are you using the toolkit, any pictures that you might have, and that's a great way for us to promote the work and give it some legs and encourage other people to get involved as well.
Working now, PG? Fantastic. I will go back and we will put it from the beginning. Now. PG, you want to make it work? And you can.
Yes, hold on one second.
Oh, here we go. Let's go to the previous slide and start this one over, but it's not working. Sorry about that. I am not sure why.
Okay, Doris, let's try this one more time.
Do you have control or you are giving me control?
Catherine has control right now.
Let me give it to you again, Doris, and we can try again with the video. Let's try again, please.
Okay.
Hello, everyone. I'm Daphne Saint-Germain. I'm a member of the expert panel of the Leading Change Toolkit. I'm a full professor at Laval University in Quebec City in nursing faculty. As a researcher in continuous quality improvement and patient safety through a nursing caring approach, I warmly invite you to become a change agent with the Leading Change Toolkit. This is a rigorous and user-friendly method to bring transformational leadership and sustainable changes in your environment. Thank you.
Well, and thank you for that beautiful message on behalf of the panel, and you will hear additional messages as we go through. I also want to thank the people that said it happens all the time when we use technology, and Alice from Australia that says thumbs up. Thank you very much for that encouragement. We did try before and somehow it was working. I want to give a special acknowledgement to my co-chair. It's a fantastic, awesome woman, Janet Squires from the University of Ottawa. She has been tremendous in the work that we have done, the dedication of endless number of hours in addition to what is a regular work, and dedication both in terms of leading the panel together with me, as well as working groups that we had, as well as the meetings that we had with the development team, as well as both of us reviewed the entire toolkit. And really, Janet, has been an absolute privilege and pleasure to work with you. I also want to acknowledge the Leading Change Toolkit development. In addition to Janet and myself that led the panel and oversaw the work, I absolutely want to first and foremost acknowledge Catherine Wallace. That lady that you see with that beautiful dress today, party time, deserves, I think, weeks of time off now. She has really carried the day-to-day work. I'm talking academic work of whatever the panel came with in terms of directions, the work that that Janet and I requested, and she really did tremendous amount of work on what you will hear later on the concept analysis. Shelly Ann was her right hand, and of course Olivia was right and left hand in terms of all the logistics, including the logistics for today, the logistics of putting all the materials in the website, which you will have a privilege to see today. And I want to also thank my colleague, Susan McNeil, who is the Associate Director for the implementation program of RNAO's overall program, which contains guideline development with NAFSIN, guideline implementation with Susan McNeil, and guideline evaluation with Shanoya, Stephanie, Christina Madeiros, Kyle, and others. These people have worked tirelessly because all the pieces connect, and you will hear also later on where are we heading once these aspects are already in the website, as today we are launching. A huge thanks to many other RNAO staffs from the communications department, from IT, Louis Charles and his team, Marianne and his team, too many to mention, but they were behind the scenes really working the technical and communication pieces related to launching this in a website that, rather than having a hard copy toolkit as we had in the past, is live, will continue to be a living resource. And on that, I want to acknowledge Susan for the idea of having it on the website as a living toolkit, which I think will revolutionize the world. I don't know how the slides are moving along because I'm not even touching them now. The project partners, a privilege to meet them. Jennifer Zellmer, first of all, that leads the healthcare excellence in Canada. Jennifer, what you don't know is that when the agreement came to me the first time, it only contained one side of the framework, the knowledge to action. And was this person with weird ideas at the time when people were rolling the eyes about social movement that said we can't, because we have been doing social movement for so long that we owe it to people to put it in writing. And never did we know that it will take this amount of work and this length. And Jennifer, I want to thank you not only for co-sponsoring, but also for your patience. Because every time we said, let's postpone it for one more month, for 3 more weeks, you understood the importance to have a product that really everybody not only feels proud about, but will really help the international community and of course, all of us at home. Marianne Darpino and Gina, thank you for your time that you have dedicated to this project as partners. And of course, Kim and Dan that were also engaged with us on this. Next one, please. And here you go. I recognize Jennifer already. So thank you, Jennifer, very much for being the executive co-sponsors. Other sponsors financially, of course, have been the Ministry of Health here in Ontario, as well as RNAO as an organization. Next one, please. I don't think I have control over the slides. It seems that I don't, so I'm going to ask for the next one, please. Is this back to you, Susan?
Yes, I just wanted to invite Jennifer to say some words as well before we
fantastic.
move on. Who else?
Fantastic. Jennifer, all yours.
Thanks so much, Doris. Thanks, Susan. And a huge thanks to the absolutely large team of people who've been involved in the process that led up to today. And, you know, I think it's one of the things we share. It's one of the foundational principles for our new organization that everyone wants and deserves excellence in health and care. But we're not there yet. And so bringing our 2 legacy organizations together, both of which have longstanding partnerships with RNAO, is really fundamentally about powering more change so that we can shape the future of healthcare quality and safety together. But that change doesn't just happen. So that's why we need a toolkit like this to expand our collective range of skills and competencies and capacities to make the change happen that we're all looking for. Because we firmly believe in the power of people and evidence connected with each other to turn all of those points of light into widespread and lasting improvements in patient safety and all the dimensions of healthcare excellence. So that's why I'm so glad we're here today. We're at that point, drum roll, of launching. And I think, Susan, my job is to turn it back to you to keep us moving.
Great. Thank you so much, Jennifer, for those words. So we've just introduced who has been involved in developing this toolkit. And now we'd like to invite you to look on this map here. Now, I just want to confirm that you can see at the top of your menu bar, view options. And when you see the drop-down menu, that you can annotate. And we're inviting you to indicate either with an arrow, you'll see your name pop up, and I'm actually going to use a heart and put where I'm from. So we want to know where you're from, those participants who are on the line. So just want to confirm that you are able to see the annotate and you're able to populate this map together with us. Okay, so I'm seeing some notes. So how about you type it in? Type in the chat box where you're from, and I'll read out some of those. And maybe if my geography is okay, can put up some of these. Oh my goodness, Doha, yes.
So I can tell you that is Chile, given that I know that map, I can put it if I find the annotation myself. But not everybody's finding the annotations.
Yeah, so I'm seeing, wow, look.
Here you go, Chile is there.
Wonderful, yes, great.
And I know Spain is there in large numbers.
Yes.
I can see them on the chat.
Yes, okay.
And look, guys, I told you at the beginning before we join with everybody that we will have 220 participants. Well, we are at almost there. Good calculation. Beautiful attendance from all over.
Wonderful to see, wonderful to see. Thank you.
And we have from Australia also, Susan.
Yes, okay, great.
There's somebody from South Africa too.
Oh, okay.
Fantastic.
Okay, great.
Beijing, our colleagues from China, look at that.
Wonderful, wonderful. Thank you everyone so much. It's great to see change agents from all over the world. So you're all welcome and we're glad you're here today. So maybe we'll move along and I'll clear these.
Ghana, we have Ghana. Look, people from all over.
Yes,
so Susan, we ain't going to say anymore that this is a national webinar. This is an global international webinar.
Yes.
Welcome everybody, both from home and abroad.
Thank you. So we can move on.
Beautiful. So let's a bit explain about this toolkit. You heard me say before to Jennifer, thank you for her patience and for understanding that we wanted to broaden the toolkit this time. So RNAO had two previous toolkits that both of them were based on the knowledge to action, yet we were using social movement activities, social movement thoughts, social movement theory in much of the work that RNAO was doing at the policy level, at the political mobilization level, and also on the best practice guidelines implementation program. So what we then shared with our partners of Healthcare Excellence Canada is that we wanted this third version to actually incorporate both frameworks, the social movement action framework, the knowledge to action framework. And that's when we approach Janet Squires, Dr. Janet Squires, who is an expert on implementation science, to see not only how we will move forward with that, but what were the best methodologies to develop in-depth knowledge to the social movement action framework. And the credit goes to Janet that it was her idea that the best methodology was to do an in-depth, serious, scholarly piece of work following a concept analysis. And you will hear about that from my colleague, Catherine Wallace, that really did the day-to-day grinding of that work. And you will see what came out of that. You will hear how using both, whether it's using both in their totality or using aspects. When you look at the website, it will also tell you that you can use pieces. Pueden usar pedacitos de cada uno de estos dos frameworks to actually push and accelerate change forward, right? So pueden usar los dos completamente o pedazos de cada uno to accelerate your success, both in evidence uptake and also in evidence sustainability, right? This is not work, and you heard Dr. Zellmer saying, this is not work that is achieved in one day. To change a culture of habit, right? That still many professionals have, healthcare professionals. Change a culture of habit, or change a culture of goodwill. We want to do the best, versus actually changing it to we will do the best. It requires not only the evidence, which in our case comes in the form of guidelines, best practice guidelines, it also requires a different type of change management process. And this is why it was so important for us to include those two frameworks so that we can accelerate that change and sustain that change going forward. Next one, please. Let's see if I can try to get, get it to me. Oops. Okay. So these are the two complementary frameworks, right? The social movement action framework and the knowledge to action framework. And in the social movement action framework, Catherine, you will take us on through it, or am I still going?
No
I
worries.
want to make sure that I give you, I will get to the policy piece for a minute. You will see that there are preconditions, key characteristics and outcomes, and that comes from the concept analysis and a framework of concept analysis. And then that drives like a wave, como una ola, that drives the change that is more systematic from the knowledge to action framework. So one brings the force, brings the how-to, brings the sense of urgency, brings the characteristics that Catherine will be sharing with us now, and drives then the change in a systematic way. It is important to understand that we have worked with the knowledge to action. Many places have worked with the knowledge to action, and Ian Graham is with us today, and he initiated that framework. And while it has been tremendous in many places, it has not perhaps have the force to move faster change. Also, it's important to understand that if one were to choose only the social movement action framework without this organized way of understanding gaps, of working with stakeholders, that also will not drive sufficiently change. This is why you see that paperclip there, that we are saying they're locked together, and together they will produce better results. Onwards to you, Catherine, for forward.
Thank you, Doris. And I think you were, sorry, I think I have control of the slide, so I will just do this. And then I think you were going to speak to us, Doris, a little bit about social movement action in the context of RNAO, of BPSOs, of our two-decade history. Yeah.
I will speak about both policy and BPG. From the moment that I walked onto RNAO, which is about 25, 26 years ago, long time, and never thought I will remain in a place this long. That was not the history of the Doris, but it was the potential of RNAO, of changing the world, of changing policy, of changing practice, of driving change in a different way that really attracted me to stay, and more importantly, attracted boards that wanted to move there, attracted members, as you can see there, that wanted to take an active stand on issues that were happening. And this has only continued to grow with the years, with the leadership of an entire association, not only the 100+ staff that all are engaged on it and the various departments, but members that have decided, and you see them all the time, active in social media, active in the streets, active in their workplaces, that want to drive change for the betterment of patient care and also for the betterment of society. So several events that we have driven for many, many years at RNAO, Queen's Park on the Road, take take your MPP to work, bringing MPPs to the workplace so they see and they feel in the gut. Social movement is about feeling in the gut, not only learning about something, but feeling that fire, that change needs to happen because what we have is not sufficiently good for society, not sufficiently good for our province or for our country. So that happened in policy for many, many years. And we started to use the same elements as we were teaching actually the VPG work. So for example, you know that we do all kinds of exercises related to art, related to drawings, related to visioning for the future. Todo eso ejercicio que hacemos con arte, all of that is social movement action. And that combined with the organized way of the knowledge to action drives change in a very different way. People ask us often, why is it that the RNAO program on evidence-based guidelines or BPGs or BPSOs have stick like a good rice, have stayed and people continue to join, and we are such a large now movement of over 20 countries, over 1,000 organizations. It is because of the combination of those two aspects. It is because the fire in the belly that we have created is contagious and people want to do good. But alongside with the fire in the belly and with collective identity that we have developed, alongside with that, they also have the organized way, I want to reinforce that, of the knowledge to action framework that helps people think in an organized way how to drive change so that it will create better outcomes for people. Next one, please, Catherine. So social movement, you need to know, continued during the pandemic. And this is the proof of the fire in the belly. It's no other way I can say it. This is the proof of people wanting to do good, not only in relationship to the pandemic itself, but not forgetting the work that we were doing with evidence-based guidelines during the pandemic. So under the leadership of Susan McNeil and the leadership of Kristen and Olivia and others, we launched Ontario Health Teams. We had begun to launch them before the pandemic. And during the pandemic, we continued the work with the 4 that we had initiated and added 3 additional ones. Similarly, you can see on the right corner, Premier Ford implemented the 3 mandatory asks for nurses. We spoke about mandatory vaccination, and I can say with pride now that is happening in long-term care. Kudos, finally. We are still pushing that it needs to happen across all sectors for all healthcare workers. Mandatory vaccination for educators, we will continue to drive that, and mandatory vaccine passports, called here in Ontario, vaccine certificates. RNAO was the first out the door in June asking for this, and this is happening. Again, this was not just done by, sending a letter to the Premier. This was done by what we call action alerts. This was done by meeting with MPPs. This was done by pushing through social movement thinking, these activities that have happened and continue to drive change both in best practice guidelines and in policy. It's important also for people to know very briefly that at RNAO, those are the 2 key pillars of our work: policy, healthy public policy, and evidence-based practice. And many times we intertwine the 2. Things may start on one, but then we follow with policy, or the other way around. I will not get into the details, but that is important also for people to know in terms of the success of RNAO as an organization. And I believe that my colleagues under Janet's leadership are driving a similar type of change that brings policy and brings people power and really is leading us to a different place. And together we will, I know, bring change to Canada, Jennifer, and with the colleagues around the world, we will bring changes around the world. Next one, Catherine, please. Similarly, a mis colegas de Chile, The work in Chile continued during the pandemic. Not only they already had 7 BPSOs under the government of Chile before, and many others that are direct with RNAO and with Amalia Silva and the universities. But in the midst of the pandemic, the government of Chile decided to add 15 more public hospitals. It tells you that the reason they did it is because of the success of the previous one, that even they saw during the pandemic the necessity to launch the others. I want to point out here, this, you can see the picture. All was done on Zoom. My thanks go to the Minsalitas, and my thanks go to PG Batten that help us the logistics of all of this. The Minsalitas and myself, these are people, by the way, covered by the government of Chile, their compensation. We launched the BPSOs, and you can see the drawings. That is social movement, right? Those drawings in 20 Zoom rooms, 370 people we trained those 4 days. And the person you see on the left is the Minister of Health in Chile that must have been saying something funny or simpatico, because it made me laugh. But this slide was actually sent by our colleagues of Chile, and they have done an amazing amount of work, same and in Spain and in Colombia, with videos, with slides. Remember, and we will also learn, going back to indigenous people and our land acknowledgement, there is so much to learn from our indigenous people. There is so much to learn from our Black communities and other work that RNAO is doing, so much to learn from our South American communities in terms of the use of art, in terms of the use of passion, in terms of the use of social movement that for many of them is a natural happening. Next one, please.
Thanks, Doris.
So now back to you, Catherine, to share about the concept analysis. Before you do, I want to remind people, credit goes to Dr. Janet Squires of saying this is the methodology we need to use to understand more. I remember Dr. Squires, I will call her Janet because I consider her a close colleague and friend. When you at the beginning, Janet said, and I say this in purpose because people need to know you do not need to be an expert from the get-go. I remember Janet saying to me, I don't know nothing about social movement. What's social movement? And I tried to explain what social movement and why it was important. And then she goes, concept analysis. That's what we need to do. And without that, we would not be where we are today and where we will be 2, 3, 4 years from now. So Janet, a tremendous thanks to you for your rigor of methodology, for leading us on the framework for the concept analysis. And now I give it back to Catherine. So this belongs to the aspect of social movement. Catherine, all yours.
Thanks, Doris. So what I wanted to do was 2 things. One, to describe the methodology that we use to formulate the social movement action that I'm going to show you, and then to introduce the framework of social movement action and its 16 elements. And I too want to thank Dr. Squires and Dr. Grinspun for their continued support throughout this process, as well as members of our expert panel and the working group and all our colleagues at RNAO, plus our co-sponsors as well for all of this work. So the concept analysis then, by definition, a formal, rigorous, and systematic process. So one that is a robust, scholarly approach in which we're wanting to understand a concept. So for us, wanting to understand the concept of social movement action, but specifically in the context of knowledge uptake and sustainability, or knowledge mobilization, so that we could develop a deeper understanding. We wanted to understand what was this concept and all of its elements and all of its parts. And part of that work included then creating a definition, as we'll share with you. And then, as I say, to understand all of its uses or its parts, we call them the elements that make up this concept. So we'll talk about the defining attributes, antecedents, and consequences. So purpose of concept analysis, again, to define the concept, to differentiate it from other relevant concepts, and then to validate it by looking at different examples. Do we continue to see expressions of elements of the concept so that we can be confident that our understanding of the concept is supported by evidence? So in addition, we used, once we had validated that concept, we used that work, then the results, to formulate a framework. We also could have developed hypotheses, tools, or instruments about the concept, but we wanted to develop a framework as a way of guiding a change initiative. So for this work, then, we decided to use the nursing theorist Walker and Avant method of concept analysis, in part because this is recognized as a rigorous and systematic approach, and that it's the most influential and frequently used approach to concept analysis. We should say that this is new for RNAO in that we have not used concept analyses as a methodology for our BPGs, so there was a learning curve, and again, a huge thanks to all of our members of our expert panel for their support with this work. So I just wanted to detail briefly the methodology that we used. And this was myself and Shelley-Ann Lee as the Toolkit developers, and the steps that we used. So we developed a search strategy in consultation with our expert panel, conducted a focused literature review with the support of a health sciences librarian. And then we conducted a systematic search of databases, and that included peer review and grade literature, some targeted journals, as well as websites, again, searching for examples of social movement action in this context. Then began the work of screening with over 35,000 articles to examine. And so we screened for title and abstract, and for full text in duplicate and independently as per quality standards. And then began the work of data extraction. This is really where the concept analysis begins to come alive, because we're looking for those instances of the concept, examples or descriptions of the concept. In some cases, we saw one specific element of social movement action described in a lot of details. In other cases, we had case studies or summary reports of social movement action, and those illustrated multiple examples of the concept and how it was expressed. From there, then we started to draft categories and subcategories of the concept. And it's this work that we would bring to an expert panel meeting, a 2-day in-person panel meeting back in November 2019 when we had in-person meetings. And we would spend over a day reviewing these draft categories and subcategories to be able to really work with the work that we had done, the results, and then be able to further move ahead the concept analysis results. I think someone moved my slides, so I'll move ahead then. And so I do just want to thank the work of the Social Movement Action Working Group and their support of this work. So this figure represents all of the components, thank you, of the concept analysis as per the Walker and Avant model, and it shows how they are all interrelated. It's important as we think about the 16 elements, they are all interrelated, and we're going to focus on the middle row then, beginning with the defining attributes, which really is the heart of a concept analysis. By definition, then the defining attributes, the fundamental features of the concept that identify the concept and how it is unique. Next, if we look at the antecedents of the events, situations, or events that must be in place for the concept to exist. And by definition, they can't be the defining attributes or the consequences, but these are interrelated concepts. And then finally, the consequences are what occur as a direct result of the concept and can be the outcomes, events, or incidents. So from the results of this work, and again, the integration of expert panel, we developed then a definition for social movement action in the context of knowledge uptake and sustainability, which we described as individuals, groups, and or organizations who as voluntary and intrinsically motivated change agents mobilize to transform health outcomes. Social movement action is a people-led action. So it involves individuals or groups, peoples acting together and coming together based on their values and beliefs as intrinsically motivated change agents, as activists who mobilize, organize, coordinate to take action with the ultimate goal of transforming health outcomes through the integration of knowledge. And so based on all of that work then, we created the Social Movement Action Framework for Knowledge Uptake and Sustainability, as you can see on the graph. This work was published in the Registered Nurse Journal. And as you can see, it depicts then these three components of the concept analysis of preconditions, key characteristics, and outcomes. As you can see, it's depicted as a graph, as a wave, and it's a series of waves of positive energy, momentum, that is creating change, that's led by people to innovate, to transform, to create new possibilities, as we heard Jennifer describing earlier. And our thanks to the senior web and graphic designer, Olga Gabrielova, who created this web design based on the discussion she heard actually at that in-person meeting. So what I want to do is go through each of the elements that make up this framework. And we'll start with the preconditions. Preconditions, again, the antecedents, what must be in place first in order for us to create social movement action. And the preconditions are a reflection of the context in which the change, the social movement action, is going to occur. And this reflects one, that change is valued and necessary, that our context is one in which we recognize that the continued application, integration of evidence leads to improved outcomes. But it's a quality that we value, we see as necessary in order to continue to create improved outcomes. There needs to be a receptivity to change, that the shared concern or the strongly desired change that is part of the social movement action, that there is a receptivity and energy for that change, that there are the enablers to move the change ahead. And then third, there are examples of social movement action are recognized, that we're aware of how powerful social movement action has been historically and currently, and have confidence in using this as an approach to change. Next are the key characteristics, and there are 10 of these, and they're not listed in a sense of being sequential, but rather that they're all interrelated, and ones that will evolve as the social movement evolves. So starting with the urgent need to take action, that there is an urgency, a timeliness, a sense that we need to take action now, that there's an opportunity to take action now, and a belief that if we take action together, that we can create change. Framing is about communicating the change and communicating in ways so that it is meaningful to others, that others see themselves as part of the change and want to become involved. It's inspiring, it's motivating. Next is an emerging leadership, that as a result of individuals partaking, getting involved in social movement action, that their leadership emerges so that they too, as formal or informal leaders, can take on more of a role in social movement action. Again, this is people-led. So we think of our frontline point of care staff with the support of others, including our senior management team being involved. Social movement action is values driven, so intrinsic motivation is key, that this is tapping into our values and beliefs, and we're wanting to engage those by being part of social movement action. We can't have social movement action without individual and collective action. These are the steps that we're taking in order to achieve change. It's purposeful, intentional, strategic in order to reach goals. Public visibility, as we've talked about today, about the use of social media, a way then of giving our social movement action a presence, allowing others to know what is happening so that they too can get involved. It gives credibility to the social movement action that we're doing and positions it so that it is an established movement, an established act of change. Collective identity, we've heard a little bit about this. This is a term coined by sociologist Malucci, in which individuals engaged in this change process develop a shared identity. It is a reflection of their social relationships to one another, being involved in a change process, and their own personal emotional commitment to that change process. And it also can be recognized as tangible representations, pins and logos, etc. But it's what it means. It means about that relationship that we have to one another and to our commitment to this change. Momentum is the action of energy in progress, that we see change occurring in activities, in events. It's like change with a pulse. We know that something is happening. We're moving ahead. We're moving forward as far as reaching our goals. We need networks in social movement action as a way of connecting people and resources, building ideas, supporting the social movement action and the development of the collective identity. And finally, core leadership structures. Social movement action, while it takes energy and commitment and passion, it does require a change team leading, guiding this process. So their role is both to help support, guide, and inform the social movement action, as well as to engage others, recognizing that a change team can never do it all on their own. They must find ways to engage others in the change. And then finally, the outcomes, what may occur as a result of social movement action. This is important to us, especially if this is new to you, to understand all of what social movement action can achieve. So it can be that goals and outcomes are met. So for example, if we're wanting to implement a best practice guideline, that occurs, that we can scale up, out, or deep change. So to spread that change, to change work cultures. And then finally, that capacity in leading change is increased, such that we build leadership at our front line, in our senior management team, to be able to support ongoing change initiatives. Okay, I'm going to turn it back to Doris. Her Spanish is much better than mine, to introduce another one of our expert panel members, who is a true advocate for social movement action. Thanks, Doris. Oh, you're muted.
Quiero introducir a Jesús Bujalance. Tuvimos la discusión, Jesús querido, de si era Bujalance o Bujalance, pero lo vamos a decir en palabras de cariño. Jesús is a leader of the BPSO, Best Practice Spotlight Organization of RNAO in the Hospital Regional Universitario de Málaga in Spain. And a very active member of the international community in the VPSO movement, and an expert panel member who is bringing also, he is present today, but he also sent tape remarks. So let's put Jesus, Catherine, thank you.
Hello, everyone. My name is Jesus Bujalance. I am member of the expert panel of the Leading Change Toolkit. I am a nurse of the Regional University Hospital of Málaga in Spain. The Leading Change Toolkit features two frameworks, the Social Movement Action Framework and the Knowledge to Action Framework. The Social Movement Action is very important because it's people-led, bottom-up approach who come together under the same goals and are motivated for change. Social movements have been used to achieve social change. We have excellent results in using social media to mobilize nurses for change. Both frameworks can be used to augment one another because you can speed up the change process, enhance the capacity of nurses by expanding their knowledge and skill as agents of change. For me, has been a true pride and pleasure to work and learn from the RNAO experts, and I invite you to use the Leading Change Toolkit for your change project. Thank you, and greetings from Spain.
Gracias, Jesús. Thank you, Jesús, and also to the many, I think from the 200 people that we have, I think we have close to 50 people Spanish speaking. So, gracias a todos por venir y por estar con nosotros en este momento. Back to you, Catherine.
We're just going to pause and check in. The chat box has been nice and lively. Thank you, everyone. There was one outstanding question just asking about the difference. Is a concept analysis similar to a scoping review? So just one question to answer before we move ahead.
Maybe I will give it an answer and then Catherine and Janet can augment. No, it's quite different. The scoping review will tell you where are we going to focus, like what is the aspects that we want to tackle, right? Then the concept analysis will take that focus and look in depth at antecedents that allow you to prepare for that to happen. The key characteristics, meaning you are seeing it and you know it's happening because it's there, and the consequences. What I want to comment is that those key characteristics sometimes, and I think in RNAO we do that a lot, can become antecedents. For example, Catherine spoke about the pin. I don't know if I am showing the pin or not, the pin of the VPSO. I will put it here in the camera so people can see. Can you see it? So the pin of the VPSO did not start, by the way, with RNAO. It started in Colombia. They had the idea of these pins. And then Spain started with the spin. And then Humber River started with other things. And Jesus started with the icon for the Twitter. And then we said at RNAO, we better catch up with the others. That is collective identity, right? That is this collective identity that now we have with Twitter, the same, et cetera, et cetera. So it is linked, the issue of your question about scoping versus concept analysis, they're linked, but there are two processes. The scoping comes before to see what are you going to tackle. And the scoping also serves the VPGs, by the way, which doesn't use concept analysis, uses systematic reviews, right? You always need to do a scoping to know where you want to focus. And then in the case of VPGs, we go to questions, research questions, and systematic reviews. In the case of the social movement action, under Janet's brilliant suggestion, obviously systematic reviews would not have done justice to this, but the concept analysis did. I hope that that helps identify. One is kind of the assessment, if you translate that into healthcare lingo. The scoping review is kind of, what are the possibilities of this assessment? Are we going to leave this out, where are we narrowing? And the other is kind of the diagnostic test. The diagnostic text will be the antecedents. The treatment will be kind of your key characteristics and the outcomes. Hopefully the patient is good, and here, hopefully we may change happen and stick.
Great, thank you, Doris. And Vanessa also contributed to the answer too, so thank you, Vanessa. I think some of the other technical questions about literature reviews and scoping reviews we can answer in the chat so that we can move, and also your questions about pins. I'll respond to you in the chat. So let's move things over to Dr. Janet Squires.
And Janet may want to augment my explanation to a more sophisticated one, by all means.
No, I think, Doris, you gave a good explanation. They are quite different. I will say a scoping review can touch on multiple things. It might touch on the concept, but it won't go in depth of what a concept analysis is really about, defining that concept and differentiating it from similar concepts, which you won't get in a scoping review. They're both about synthesis of literature, but they have very different focuses. So I'm going to change direction now, and I'm going to talk a little bit about the knowledge to action framework. So whoever's controlling the slides is not me. There we are. And so I know a lot of you will probably be familiar with this framework, but I am going to touch on it at a high level. So as Doris mentioned earlier, this framework was developed by Ian Graham and colleagues in 2006, and Ian Graham was one of our members of our expert panel.
And if I may, just Janet, for the sharing of our previous toolkits, our first and second toolkit actually focus on this framework. And in fact, Ian was involved also on the first one. And I think some of the concepts of Ian also came from that initial work in 2002 with the initial work that the panel did with him as one of the lead people at RNAO.
Okay. And so I'm going to give just a very high level overview of this. There is a lot of detail in the toolkit on this framework. And there's also the development paper there listed on the screen for anyone that's interested in learning more about how it was developed. So this framework is what we call a plan action framework. And that means it looks at the process of implementation. It's very pragmatic framework to use, and it's really easy to use because it breaks down the process of implementation into manageable components. So a lot of people like it for that reason. As you can see by looking at the slide, the framework has two main components. It has a knowledge creation in the center, and what's going around in a circle around that knowledge creation is called an action cycle. So they're the two core components of it. So I'm going to start with the funnel in the middle, the knowledge creation funnel, because it doesn't always get the attention that it deserves because everybody wants to move right to the action piece. But the knowledge creation funnel is really important. And as you can see there, there's really three levels of knowledge: knowledge inquiry, knowledge synthesis, and knowledge tools and products. So the first level there that you see is knowledge inquiry, and that reflects individual primary research studies that result in the creation of knowledge. So this is also known as first generation knowledge. Then if you go down a level, you'll see knowledge synthesis, which a lot of people would be familiar with. And this is in the middle of the funnel, and this is knowledge from the compilation of multiple research studies. So what Catherine just presented to you was an example of knowledge synthesis. And then the third, that's known as second generation knowledge. And then at the bottom of the funnel is knowledge, tools, and products. And this is the most refined level of knowledge. And this is known as your third generation of knowledge. And this is hopefully what you're planning most of your change on. And the RNAO recommendations would be an example of knowledge, tools, and products that are based on rigorous compilations of knowledge synthesis. And so that's really where you want to be implementing, is based on these knowledge, tools, and products. And then if you look—
So an example for our BPSOs will be our BPGs, right?
Yes, that's what
best practice guidelines.
Yeah, the recommendations from your best practice guidelines. So surrounding the knowledge funnel is the action cycle. So if you look at the first phase there, like we really started right there at the bottom where the knowledge funnel goes into the action cycle. It's determining your knowledge do or knowledge practice gap. So once you determine that gap, then you're going to go into adapting the knowledge to the local context. Now, you're not really going to be adapting the knowledge per se when you're using RNAO guidelines. They're already made for you, but you may be adapting the delivery of the guidelines. Depending on what organization you're in, you may have to deliver those guidelines slightly different. From there, you're going to go into assessing the barriers and facilitators to the knowledge use, which is critical because this is going to be highly, your success is going to be highly dependent on assessing those barriers and facilitators. And this is going to differ by organization. What's a barrier in one organization may not be a barrier in another organization. And as a nurse, I would even say it could differ unit by unit. What's a barrier in one unit in the organization may not be a barrier in another unit in the organization. Then you're going to select, tailor, and implement your interventions based on the barriers and facilitators that you selected. Then it's really important that you want to monitor ongoing your knowledge use and evaluate your outcomes, for example, the impact. So a lot of you implementing RNAO guidelines will be collecting outcomes like patient outcomes using the Enquire database. And from there, you want to look at sustaining knowledge use. And sustainment is really important. You want to be thinking about that throughout the whole implementation process, not just 2 years later when you're actually into sustainment. So you want to be thinking about sustainment the whole way through. And so it's presented very systematically, and most people will follow it in a systematic approach, but it is fluid. And some people, you will go back and forth for some people between knowledge and action several times throughout the cycle. But it's meant to be a very rigorous, very systematic approach, and it's just broken down in very manageable pieces. We could go to the next slide. And so what we wanted to show you here is just really how the toolkit is laid out with the knowledge to action framework. So you don't have to go through hundreds of pages to get to what you want. It's really laid out according to each phase of the knowledge to action cycle. And so there are sections in the toolkit about strengthening your knowledge. So if you don't really know what the assess barriers and facilitators phase is all about, they'll tell you what it is and why it's important and give you more information about that phase. And then there's a lot of sections that help give you skills in conducting that particular phase of the cycle. So you'll get practice tips while providing you tools. You get case studies and examples of people, how they have applied that phase in a real situation. There's checklists there to help you monitor your thinking and your progress in that phase. There's worksheets, linkages, additional resources, and how you get ready. So now that you've done the barriers phase, how do you start thinking and getting ready for the selecting, tailoring, and implementing intervention phase? And so you may know some of these phases really well, and there may be other phases that you feel that you need a refresher on. So the toolkit is designed so that you can go exactly to the phase that you feel that you need to be refreshed on. And so there's a lot of information there. Anything you want to know about the KTA, you should be able to find it there in the toolkit. Next slide. And so one thing that's new this time is we've added tools. So previously there were not tools in the toolkit about the KTA. So I'm going to present just a few slides on the tools, and then later Catherine is going to show you an example of how it's set up. But I just want to acknowledge the sub-panel of the Leading Change expert panel that was helping with that. So myself, Dr. Ian Graham, who is the creator of the KTA framework, Dr. Alison Hutchinson, Jennifer Plant-Mato, Jean Zhou, two students from the University of Alberta, Melissa Demery-Varon, a PhD student, Wilma John Santos, a Master's of Nursing student, and Laura Alicio, who was a research coordinator, and plus two RNAO staff members were highly involved in this. Catherine Wallace, who's been highly involved in all parts of the toolkit. She was highly involved in this as well. And Shelley-Ann Lee was also highly involved in this work. Next slide. So in total, there are 33 KTA tools that are in the toolkit currently. And because the toolkit is a living toolkit, as more tools become identified and available, they will be added to the toolkit. A large amount of the tools, 30 of them, go to assessing barriers and facilitators to knowledge use and also monitoring knowledge use. So you can use any of these tools for assessing the barriers and facilitators or for monitoring knowledge use. And we've done assessments for them to help you decide which tool meets your needs the best. Next slide. And there's also a few other tools here. We have two tools that look at identifying the problem, determining the no-do gap, and we have another tool there that goes towards sustaining knowledge use. Next slide. And so this is just a little bit about some of the assessment that we've done, and you'll find summaries of this for each of those 33 tools in the toolkit. And so what I want to focus on here is that we really did focus in on pragmatic criteria because that was really important. And we didn't decide ourselves. We didn't decide ourselves what was pragmatic. We had frontline people do assessments of all 33 of these tools, and they assessed it for acceptability, how easy it was, how compatible it was, and how useful it was. Some of the objective assessments that you see here, we also assessed as members of the toolkit, like we looked at the cost, the language. Was it going to be hard for someone to learn how to use the tool? Was it going to be hard for someone to interpret the scores of the tool? But generally, most of the assessment was done by, some of you were the ones doing the assessments. It was done by people in BPSOs who were on the front line, the people who were actually going to be using the tool. And just to give you an idea what some of these words mean, like acceptable, we looked at things like the cost and was there advantage to using this tool over another tool that somebody may already be using. For easiness, we included things like the number of items, like, so there was a set off rule of 10, like, you know, nobody really wanted anything with more than 10 items. It had to be quick and easy to use. We looked at reading level, was it difficult to administer? For compatibility, we looked at, was the measure viewed as appropriate for the situation? And useful, we looked at, did it fit with the organization? After the pragmatic criteria was set, and if it met a minimum threshold, we then looked at the content validity. We just wanted to be sure, was it really measuring exactly what it said to be measuring? So did it really measure the no-do gap that it was purporting to be measured? And so we have summaries of that in the toolkit. So when you go into the toolkit, Catherine will show you later, you'll be able to see a high-level summary of the pragmatics and the content validity, and then you'll actually be able to see the more detailed assessment if you want to. Next slide. I can't quite remember. Okay, so we're going to come back to some questions in a minute if anyone has it, but first I want to introduce a video from Jean Zhou. He is a PhD student, candidate actually in the School of Nursing at the University of Ottawa, and he was a member of our expert panel, and he's going to talk to us about the social movement action and the KTA framework and how they can be used together.
Hi, I am Jun Qianzhou, a PhD candidate in School of Nursing, University of Ottawa. I'm a panel member of the Leading Change Toolkit. I'm so excited to see the release of this toolkit after 2 years hard work of the team. Knowledge translation is a technical work, but a really complex social process. That's why in this toolkit, we innovatively integrated 2 frameworks, the Knowledge to Action framework and the Social Movement Action framework to inform evidence uptake and sustainability. The Knowledge to Action framework describes and guides the process of translating research to practice. And the Social Movement Action framework helps us to gain a deeper understanding of the social mechanism, how and why change happens through collective identity, the network between intrinsically motivated individuals, and the collective action. The global best practice spotlight organizations initiated by RNAO are the best examples of the use of this social movement action framework. This is really a groundbreaking project, and I invite you all to use this Leading Change Toolkit for your change project. Thank you. Hi, I am.
So Susan, do we have any questions in the chat box regarding the update that we heard from Dr. Squires regarding the KTA framework and the KTA tools?
I've been answering questions as we have been going along, and we'll continue to do so. And maybe I'm also showing people where they can find answers in the toolkit itself. The About section of the toolkit goes into a great deal about our methodology, and also referring people to the glossary. I'm just about to put that in the chat. So I think we'll continue to move on. Thank you.
Okay, great. Okay, and I think we were going to look now at the toolkit. I'm wondering, just in the interest of time, we do want time for that, but let's make sure we hear from all of our speakers first. So we'll come back to looking at the toolkit and look forward to that. But if it's okay, Gina, if we can hear from you just regarding, you're going to share with us how you anticipate Healthcare Excellence Canada will be using the Leading Change Toolkit and using this for your coaches.
Yeah, thank you very much. So I was going to talk a little bit about some key learnings of personal journey, but I think I'm going to skip through that because we've heard a lot of examples along the way. And really just to say that Healthcare Excellence Canada really has a highly motivated and engaged staff to improve quality and safety. So we're really in the business of finding those innovators and innovations. So, the addition of the social movement framework to using our KT and QI concepts in our work is really going to be an enhancement. We're going to be embedding it into our coaching resources to be really used as a key resource so that we can further develop our coaching model at Healthcare Excellence Canada. So thank you to RNAO really for the opportunity for the past couple of years partnering to do this work. I'm really excited to see the outcome and really the experience of those using the toolkit, and really look forward to the impact evaluation that we'll be doing. So I'll pass it back to Susan and Catherine to share next steps for supporting change agents.
Thanks. Thank you, Gina. Susan.
Sure. Well, so who is this Leading Change Toolkit for? It's for all of you on the line today. Any individual change agent, any team who really is invested in wanting to make a difference, wanting to improve healthcare, the quality, the safety, transform how care is delivered. So what we're doing at RNAO is we're really looking at some of the capacity building and competency development among champions, BPSOs, even ourselves. And even at RNAO, and Doris mentioned this before, like some of the leaders who work together with RNAO. So we really are looking at the next steps of how do we embed all of this, the content, knowledge, skills into our programs here at RNAO. So we will be also enhancing many of our training offerings. So that's the Champions curriculum and other knowledge exchange opportunities that we have. So you're going to see lots of enhancements as we move forward. And Catherine, maybe I'll just talk a little bit about the next slide here about the ways to connect with us. So we really want to connect you to connect with us. This is a living toolkit. We are going to be hearing from you in a variety of ways. And Gina mentioned looking at our impact evaluation. So we need your feedback and we need to hear from you. And we need you to help us continue to enhance, strengthen, and make this user-friendly. So we're inviting you in a few different ways. So tweet, actively be involved using the Leading Change Toolkit Twitter handle by tweeting like, what are you doing? And sharing your results with us. We also have a dedicated email so that you can share any stories, tips, resources that you think really belong in the toolkit so that we can consider that for future iterations. And as Gina mentioned, so we do have a survey that's embedded within the toolkit itself, and are inviting you to let us know, what parts of the toolkit are you using? What is working really well? How, any suggestions for enhancing it, and also looking at what impact it's making. So we're relying on you to help support this ongoing development of this living resource. So we can, I think there's an acknowledgement slide coming up next that recognizes.
Before we do the acknowledgement slide, I do think that we forgot the acknowledgement slide of the Social Movement Action Working Group. So I just want to share that people like Natalie, like John Zhao, like May, and others were very, very involved on that. And we will make sure that we will put that slide too in when we put all of this on the website. Apologies for that. You guys did an amazing work with us. Also important to know that we have incorporated the use of social media. That's the latest piece that we have incorporated, media in general and social media. So you will find tools also on how to use social media for those of you that are not involved in BPSO movement. But in other changes that you're doing, that will be very useful for you with excellent tips. One of the pieces that the development team and the panel have done amazingly is that while you have all these theoretical pieces that today we share a lot with you, there is a lot of tools on how to go about using every aspect of both the knowledge to action, which Janet Squire spoke about, also in social media action, tools that people have used, whether it's tools that we brought together or others from other sources, that will help you put this in practice. It's massive what you will see on the website. Don't get lost. And if you do get lost, find what's useful for you. We are committed to doing a Reader Digest version. So within a year, you will see the Reader Digest version for those of you that need more concise. So please know we are on it, as well as we are on the competencies, and all of that will be shared live for you to use, whether you are involved with VPSOs or with healthcare excellence or with RNAO, or you are not. The panel, I want to recognize the entire panel again before we go to the impact evaluation. All of the people that we recognize at the beginning, they will continue as an advisory of this work. And we will bring them together once a year to first share what the use has been, how it is helping, to hear from them, from their various countries, how useful, what was the uptake, what do people are saying that we need different. And in that is important, the impact evaluation, and I give it back to you, Susan, so you can acknowledge the people and how to give feedback in the go forward.
Yeah, so I think I can talk about that a little bit as Catherine is bringing up the actual toolkit itself, because I think some people are actually, and I think maybe this one will just pause. Yeah, great. And I think that some people are actually going right to the toolkit right now.
Well, that's a good sign. That's a good sign.
So that's great. So good, Catherine, just go ahead. Thank you.
Thank you. And just confirming that you can see the Leading Change Toolkit.
We can.
Perfect. Okay, so this lives on the RNAO website. It is an online living toolkit. So you will see the RNAO menu here, but I want you just to scroll down just a titch, and then here you will see the Leading Change Toolkit. And this is at rnao.ca/leading-change-toolkit. It also is inside of the BPG tab, if you're familiar with our website, under the heading of implementation, which is very fitting because it is an implementation resource. As you can see from our homepage, we have then the graphic of the waves to depict the social movement action, as well as the knowledge to action framework. And that's because this is a toolkit that is using these two complementary frameworks, as we say, to accelerate your success. The Leading Change Toolkit is organized according to these four broad subject areas or chapters on about this toolkit, where you'll find the table of contents, some other content that I'll share with you. And then we have sections on each of the two frameworks. And then finally, engaging persons with lived experience, because we know that part of your change initiative can include including persons with lived experience as part of your change team. So on this homepage, again, there is acknowledgement of the partnership between RNAO and Healthcare Excellence Canada, and that this is a toolkit to help change agents and change teams to make lasting improvements. Here are the table of contents. These are developed in cards. And again, our huge thanks to our IM&T and Comms department for all their work in supporting this, as well as the panel. So you'll see here a more detailed table of contents in these four sections. We'll start with about the Leading Change Toolkit, but you'll also see that on the bottom here is engaging persons with lived experience. And then at the very bottom here, then we have this linkages. We'll talk more about that in a moment. And then this is the link to the survey. So if you have feedback for us, this is one way in which you can give it to us. And also if you have other comments, again, we have the dedicated email address, as well as you could even use the contact us on the RNAO website. But let's go back to the about the Leading Change Toolkit. And I encourage you first to look at finding what you need in the Leading Change Toolkit, because it walks you through essentially a detailed table of contents, how the sections on the frameworks are organized, so that you can understand the structure of the toolkit. And as Dr. Grinspun has indicated, there's a lot of content here. Our intention here is to support you with your change initiative, to not overwhelm you. Find what you need, use it at your own pace. There likely are elements from social movement that you're already using, so maybe you want to learn a little bit more about that. Perhaps you're very familiar with the knowledge to action framework that Dr. Squires was describing, in which case then to start think about, could we add some elements of social movement action to enhance the work that we're doing in our change initiatives. I want to focus just on the accelerate your success with the two complementary frameworks, because that's really the key takeaway of today, is really that by using these two complementary implementation frameworks, social movement action and knowledge to action framework, that when we see these strategies action cycle phases and the elements of social movement action, it can accelerate your success. It can be tools to really help to move and engage knowledge translation. So on this title page, a short description of each of the 2 frameworks. Again, we have full descriptions of each of these with many, many pages for you to enjoy and read. Some discussion of the benefits of using both of these frameworks. And then we have the linkages. Doris called them paper clips. And essentially, yeah, they're holding these 2 frameworks together. So linkages you'll see in these pink boxes, in which we're looking at a specific strategy or approach that you could be applying from one of the other frameworks to the framework that you're working in, as a way then of just building and enhancing your change approach. And then the other is at the end, as we'll see in each of the frameworks, in each of the sections, there is a final section about how we can link the work of this action cycles phase or this element of social movement action, how we can link it to the other frameworks. Again, trying to just get you to start thinking about, if we're working in this area of the framework, then how can we introduce and apply the other one? A little bit more about the linkages. And then what we have next for you is a checklist for change agents and change teams. What does it take to be an effective change agent using both of these frameworks? And again, we've heard from Susan and from Gina about how they'll be moving forward and how we'll be moving forward with our champions, with BPSOs, with ourselves as BPSO coaches, as an organization, to be able to support others in the use of these 2 frameworks. So some description there, and you will see that there is an opportunity to download this, and you can print the downloads if you wish, so that you can have that as a resource. Otherwise, the rest of this material meant to be read and enjoyed online. Next, we have an example of how to apply the 2 frameworks to guideline implementation. So we wanted to give you an example where we took a scenario where the person and family-centered care, BPG, was being implemented, and then walk you through a change process. We won't go through this all right now, but you open this, and then what you would see is a description of planning for change initiative and how this is incorporating both of these frameworks. And then these are live links. So if you click on these, then you'll be able to open them and see more about this content, about both of these frameworks. But we wanted to show you an example just to see how in implementation, how these 2 frameworks can be applied. Next, something you may be wondering yourself, well, what if we're not quite ready to use both of the frameworks right away? This may feel like a lot when we've got 7 action cycle phases and 16 elements of social movement action. I think if my math is right, that's 23. My goodness, that's a lot. So maybe you feel like, okay, that might be a little too much for us right now. So while we strongly recommend using both frameworks, we understand that it isn't always possible and may not always be the best. So it may be that, in fact, you're using elements of both of the frameworks as your approach. So for this, then we developed a decision tool to help you select which parts of these 2 frameworks that you would want to use, and develop this decision tool that walks you through a series of questions, 11 guiding questions that will help you to see the similarities and the differences of these 2 frameworks. They are both implementation frameworks that support the uptake and sustainability of knowledge, but have different approaches. And so you can walk through these questions. Again, there is a download of this as well, so you can edit and put your answers to those questions. But we want for this to be very much an active process. You can't just read the toolkit. As we all know, change is a very active process. So, but taking the time as change teams to answer these questions can help you to better understand the frameworks, which one might be best for you, at least as a beginning start. A short section on framework fundamentals for those of you not familiar with how they can be used for a change initiative. So I need to make it easy there. And then what follows then is applying the elements of the social movement action framework. So if you've decided that you're going to start with one framework and then gradually work up to using both of the frameworks, then we give you more detail about each of the frameworks, again, applying them to a scenario so that you have an understanding then of how the framework works. And then we have a similar example with the knowledge to action framework, again, applying the action cycle phases to a change initiative. How am I doing with time here, Susan?
We're a little over. We just passed the 1:30 mark. So maybe I'll turn it over to Doris. Yeah.
We have 140 people in, which means they're very interested. Okay. Keep going, is my suggestion.
All right, thank you. So I'll click on Social Movement Action Framework. This is the landing page for the framework. It describes the framework. There is the graphic again, and then here are the cards that are describing the table of contents for the preconditions, the 10 key characteristics, and the 3 outcomes. And then we're going to click on one of them just to have a look to see how the content is structured. So let's look at collective identity. So you can see here we have a hero image. Learned so much from IM&T and Olivia. This is called the hero image of the key characteristics, so you know where you are. And if you get lost, just go back to your home there, and you will be able to find your way. So we talked about collective identity, this shared identity that develops as a result of individuals engaged in a change process that includes social movement action, a very powerful force of collective action that keeps people engaged, the we-ness or the glue that holds us together. So the section organized by what is this key characteristic we're describing, and we can see some examples of collective action. Why is it important? And so we really want you to understand how this element plays a role in social movement action to really help you to see what benefits are there to including this in your change initiative. And see some pictures, and we've got some videos, etc., embedded in this content. And again, if you have pictures and images you want to share, please do. More about the characteristics. So again, to build your knowledge. And so we divide out the collective identity as far as the cognitive parameters, the social and the emotional ties. And I do just want to point out to you then on the right-hand side, so all the pictures, I'm going to move us all over there. There we go. So the navigation menu on the right-hand side. So currently we are in the Social Movement Action Framework part of the toolkit. Again, a section on preconditions, a section on key characteristics, and then right now we are in the section on collective identity. So again, we've got, as Dr. Squires was describing, then we have a section on considerations for getting started, some case studies to illustrate this element of social movement action. We also have a section on common problems because change is rarely perfect. So some common problems you might encounter with your collective identity and then how to address those. A section called Check Your Progress. How do we know if we're making any progress as far as the development of collective identity in this case? And then this section on linking this key characteristic to other framework components, in which then we're talking about how can we apply collective identity in the context of knowledge to action framework. How can we introduce some of those elements to support collective identity and vice versa? And then finally, an additional resource that has some other resources that might be of interest to you when you're in this aspect of social movement action. Next, the knowledge to action framework. And I do want to take a minute to show you the KTA tools section that Dr. Squires was describing to us. So again, here is our landing page for the knowledge to action framework that describes the framework. And then again, we have the 7 cards for each of the 7 action cycle phases. And while we use identify the problem as the first card, it isn't necessarily where you're starting your initiative. So whatever feels right is where you'll start. We're going to look at the monitor knowledge use because this is one of the ones that has the KTA tools. And again, on this card, you will see all of the, essentially it acts like a table of contents where you can find, and these are all live links. So you can just click on those if you don't want to go through, scroll through all of these pages, if you wanted to just see a specific section. So the monitor knowledge use includes similar content in that what is this action cycle phase? Why is it important? Again, to establish why it's important to take the time to do this work and monitor knowledge use before we get to evaluate outcomes, and more about this phase, and again, some graphics. If we look again on the navigation menu, we can see there is assessing knowledge use, data collection approaches, so different ways in which we can monitor knowledge use, the importance, why is it important when we are monitoring knowledge use to consider knowledge, attitudes, and beliefs. This can very much influence outcomes. Some practice tips, again, wanting to offer some pragmatic and practical tips for you. Case study, again, you'll see some of the similar components as we saw in social movement action. the section on tools, which we'll come to in a moment, check your progress, linking this phase to the social movement action and additional resources. So let's open the KTA tools because some of you will be interested in seeing how this works. So for 4 of the action cycle phases, you will see a section on KTA tools. There's some introductory content here. We have, in addition to the tools that I'll show you in the table below, a couple of supporting resources. So one that is a summary table. It lists all of the tools. It tells you in which of the KTA action cycle phases the tool can be applied. We have a table that shows all of what the tools are measuring. And this is just meant as an overview for you. With 33 tools, that's a lot. So we wanted to give you some summary tables just to help you manage this content. And then secondly, we have another document, considerations for using KTA tools. As members of change teams, it's important to consider, how are we going to select a tool? How are we going to implement it? And then what? What do we do with the results so that we're using tools intentionally to help our change, move our change initiative forward? So some information about that for those who are new to using tools. So then what we have in this table is 2 columns. So one with the tool with the summary page, and then secondly, the companion document, as Dr. Spars was describing to us, that includes the pragmatic and psychometric details. So I want to open an example of one. Again, this is a tool that can be used in the action cycle phase of monitor knowledge use. So we look at this example of context assessment index. And the context assessment index, so we won't look so much at the details specifically of this tool, but what you'll see is it will describe briefly, it's meant to be like a 1 or 2 pager that will describe the tool's purpose. And we really want you to think about the purpose and whether it's a good fit for what you're needing for your change initiative. And we want you really to be intentional with using tools that really can use them to enhance the work that you're doing. It will describe briefly all the tools, the components, the domains that make up the tool, so what it is measuring. The summary sheet also will identify which of the action cycle phases are can be applied, what languages it is available in. There is a link to the tool itself, and you can open on that. Perhaps I won't do that right now, but it links you to the tool. There's also, in this case, a manual for the tool. So all of this available, which is great. Now, if you have any questions regarding the tool, can we use it on with physicians when it was originally developed for nursing students, for example? We want you to consider reaching out to the developer of the tool, and we have, with their permission, included their email address. So if you have questions about the tool, this is the person then to reach out to, and you'll see for each of the tools, we've listed that individual. And then, and finally, we have the development paper, the psychometric article, sometimes all in one, sometimes 2 articles. And where it's open access, then we have a link to that as well to help support you in the use of this tool. So lots of content there. And then just coming back again, a companion document, again, for this same tool. And if I click on this, here again, same tool, context assessment index. And here you will see the details of the pragmatic testing and the content validity data. And so for a number of pages, and then there is the references at the very end. So this is reflecting the work of the Toolkit developers, as well as the working group on the KTA tools. So we hope that you will find this as an asset to your change initiative. And again, any questions regarding the tool developer, any questions regarding the psychometric or content validity of the tools, we probably can answer some of those for you. So I don't know, Janet, if you wanted to make any other comments regarding this work. I think it's a huge, wonderful addition to our toolkit. We'll be interested to see how change teams use this content, but just anything else you wanted to mention, Janet?
Not really. Like you'll see the psychometric and pragmatic side. You'll see a summary first, and then the pages that come after that is just the details for anyone that wants to see how that summary was put together. But some people will just want to know, okay, they say this has content validity, but if you want to see exactly how it scored on each item, you can see it. You can see it there. If you want to see exactly how it scored on acceptability, usefulness, you can see that, but you can also just look at the summary as well. And things had to score at a certain level to be included on this webpage. So if we ranked any tools, and there were about 10 tools that got thrown out based on pragmatics because they were not, the stakeholders said, no, we would not use this tool. So we didn't even put that as an option. If it's, or if it wasn't publicly accessible, it had to be freely accessible for us to include it. So there are some tools that got excluded based on those reasons. So you have the summaries, but you have more details there only if you want to see those extra details.
For sure. And also if you're really wanting to know more about the tool and how it was developed, again, that link to the development paper will give you even more information.
And the other thing, by all means, like, you know, use the email that's provided. And if there are tools that you're using and that you're wondering why they're not there, do send them along. So when the updates are done, we can assess them. And there might be a reason it's not there, but it may just not come up in the search, the first search that was done for tools.
Thanks, Janet. And I would add too, if you do have experience using the tools, we'd love to hear about that as well, so that others can learn from that, how you've used it and used it effectively in your change initiative. Is that what you were, Doris, you're smiling. So is that what you were going to say? Am I reading your mind? I just wanted to last show you this section on engaging persons with lived experience, just briefly. Again, for many of you, part of your change initiative does include engaging persons with lived experience. So we wanted to include some content on that so that we could have the most effective inclusion of those individuals. So again, it's organized in sort of much the same way. What is this, this part of change initiative? Why is it important? More details. And then what follows below here is the table of contents. So there's some content on a continuum of engagement. Really good section. Is your change team ready to engage with persons with lived experience? And some guiding questions to support you in that process. If you're engaging advisors, advisory councils, how to do that effectively. What do we need from our organizational culture to be able to support the engagement of persons with lived experience in change initiatives? Quite a detailed section on considerations for getting started, some examples of effective engagement, evaluation, case study, check your progress. And I think we finished with additional resources. So again, a fulsome section that I hope that you will find helpful for your change initiative. Again, all of this content available on the RNAO.ca website. You don't have to be a member, although we'd love if you're a member of RNAO. Anyone can look at it. You don't have to be a nurse, be any member of the interprofessional team, any stakeholder, person with lived experience. Please have a look at this, and we welcome your feedback on the toolkit as a living document. We welcome to hear your experiences, any photos. We have a lot of pages. We could use some more graphics and pictures, so please share those with us. Maybe I'll hand it back just to Susan or Doris just to see if her final comments, and then I'll maybe pull back up the crowd.
So I will make final comments, and then we will put the polls out so people can tell us their thoughts. You can put them meanwhile that I speak, and then we have a very brief video that we want you to see, and then we will let you go. I commented to the many comments. I was now looking also at the comments that people have made, thanking us as a collective for the work, for the pragmatism of the work, for bringing two frameworks together, for helping them understand the context that we live in, etc. And it made me feel, I always, through this process, I felt that we were developing something revolutionary, and it is. It also, now that I hear people and the feedback, it makes me feel we are gifting the world. And I think it's a nice way of putting it. I think the panel as a whole, the three working groups that put additional time, this is panel members that put additional time in really going in depth on every aspect. You, Catherine, I cannot say thanks enough, because many of these 400 pages, yes, we help, but you actually, the reality is toilet every single day, long hours. Yes, Shellyanne was on your side, but you led this piece. Susan, for your idea of doing this on the website, and just fantastic. Janet Squires for the methodology of doing this as a concept analysis. Olivia, I know you put gazillion hours in putting this on the website, and of course, Olga, Marian, Mike, everybody, Lola, everybody, LC, and everybody is worth it. And to Jennifer, Jennifer as representative of healthcare excellence, and Gina, you were involved in the nitty-gritty, but Jennifer, that came kind of in the middle of it when you merged the organizations and said we keep going and had patience to wait. I hope you all feel as proud as us today. It really, I think, and I have said this to our team, this is the next frontier of implementation science. I think we are going to revolutionize the world of change management from what usually continues to be top-down, de arriba para abajo, jerárquico, at this organized, knowledge to action, pragmatic with tools that can be used, and no one will say, what do I use in phase 1, phase 3, or etc. And also this wave of energy, right? With the tools to how to both uptake evidence and sustain. I think one of the aspects that the development team did that is fantastic, and we didn't pay enough attention or respect to it today, and I want to make sure people look at that, is the case studies of how people bring these two together. You don't need to be a master, not of the knowledge to action and not of the social movement. These are tools that you can refer to it like in a book. You refer back and back and back, and you master one piece, then you master another piece. But try, please, not to use one framework alone. As much as you can, whether it's just 2 aspects or 3, use them together, because once you start to click them together, and I cannot speak without, it's a way of being, it becomes a way of being. Que traten de usar, por favor, los 2 frameworks, aunque sea un poquitito de cada uno juntos, porque una vez que lo usan juntos, nunca más pueden pensar diferente. And I think this is what has happened to people. And I know slide 25, I apologize. I didn't read it when I was going through it, through the implementation subcommittee. All of those people that were involved, I mentioned just a few. I know you can not only now work without looking at both. I think as a whole, we are gifting the world. And the only thing we ask from all of the participants that continue to stay is use it, use it, use it. And then tell us what works, tell us what we need to improve, and then we will catch up with you with recommendations on competencies and how to develop competencies. And the work will continue, as Catherine said, is a living document that will continue to work with your feedback, and we will do webinars. This is just the beginning. This is the launch. The team will do webinars ongoingly on this. They're all free of access. The toolkit is free of access. It's a gift to the world, un regalo para el mundo. Thank you very much. And I think people already responded, I believe, to the questions.
Yes, it's been very helpful. So thank you. A lot of enthusiasm for getting started and using the toolkit right away, and some good feedback here as well to help us determine the best ways to give you updates. So I think we could probably move now to end with our video, and just to thank everyone so much for their participation.
And thanks on the video for Madison that worked the specifics on all of the videos that we have related to the guidelines program, and in particular this one.
Every day around the world, nurses and other health providers strive to improve care using evidence-informed practices. At RNAO, we make it easy for you. We provide you with free of charge best practice guidelines, or BPGs. Together with our partners and an international expert panel, we have created the Leading Change Toolkit. It is a free, dynamic, practical online resource designed for change agents and change teams, people like you, who care about making evidence-informed changes to improve outcomes for persons, communities, organizations, and even entire health systems. No matter your health setting, role, or if you are leading change as a formal leader or as an informal leader, like a point of care staff person, this Leading Change Toolkit can revolutionize how you can help to lead and sustain change to make lasting improvements. The Leading Change Toolkit includes 2 evidence-informed frameworks to guide your success. The Social Movement Action Framework is a grassroots, people-led approach to change. It is used to mobilize and engage people in exciting ways to make a bigger impact through individual and collective action. The Knowledge to Action Framework is a structured approach to change. It is used to guide you and your team through all the phases of action, to move and sustain knowledge into practice. We encourage you to learn about both frameworks. They are complementary, and when used together, accelerate change. Learn about the Leading Change Toolkit today at rnao.ca/leading-change-toolkit. Jumpstart your change with one or both frameworks and find all the information, practical resources, strategies, and tools you need to lead successful change. We invite you to also attend the RNAO Best Practice Champions Workshop and join the Best Practice Champions Network to learn more about how you and your team can lead change that lasts.
Beautiful. Thank you, everyone, for staying over time. I think it's worth it, and use it. Get back to us. Tell us how it's working. And we will be back to you both with the toolkit. I know a couple of people WhatsApp me. We will be back with the toolkit for you in Spanish. Yes, that will take some time. And on that, I need to acknowledge my amiga Maite Moreno from Investen, that they do all the translation of the guidelines. I'm sure they will do the translation also of the toolkit. And in due time, we will translate also to French and to other languages as we do with the guidelines. Thank you so very much to the team, to everybody involved, to the panel in particular. We know that this was work in addition to all that you do in your working life. We know that Australia colleagues came at the wee hours, China colleagues wee hours, even John from UK at the wee hours. Thank you, colleagues. I hope you feel like we do, that is worth it, and to be continued. Thank you.
Thank you, everyone.